what's it called? Plastic in a microwave, all those microwave things, all those radiations all around us, even from our homes, we can generate it and it can cause it. It doesn't have to be that somebody has, mature before the person can develop the lump. And as I said, sometimes it is hereditary. If a mother has it, a grandma have it, it is hereditary. There is what we call BRCA1 and 2. Is an hormone in the system, is a gene in the system that when one have it, that's the grandma has that BRCA1 or BRCA2, and it is in the gene of maybe the third generation. The second generation might not have it, might be in the gene of the third generation that the person will now develop the cancer. So for people that have that BRCA1 or 2, they have this tendency of being exposed to cancer of the cervix, majorly, cervical cancer, majorly. So it can run the family. So anything can cause lumps, just as I said, and it's just that we should do it. We should check ourselves often so that we remove it. Once it has been removed and it is sent for tests, after the removal, they send it for histology and be sure that it's not cancerous. If it's cancerous, then they have to treat and put that person on chemotherapy. Then somebody was asking of unequal breast. That's why, yes, there are some it said people are not, even twins are not made equally. So naturally some people might have a breast that is bigger than the normal, but it's not always very obvious. It's not always very obvious. But what make us to make it obvious is when we start now concentrating on the bigger one and now leaving the smaller one, then you now see it. That's now the bigger one becomes bigger. That's what I'm trying to say is for the ones that are breastfeeding especially, let's make sure that we empty one breast before we go to the other breast. If we are breastfeeding, let's empty one breast before we go to the elder breast. If we did not empty one breast, it will not give the baby adequate thing. The compartment of the breast, sorry I'm diverting, is in two. They wear forewater and hind water. The forewater is more of water. The hind water is more of fats and proteins and what will enrich that baby. So when you see two children only on exclusive breastfeeding for 6 months, and you see the difference, one will be bigger with cheek and the other one is just pakpo. It means that one that is pakpo is just taking only the water. That's the mother is just given, maybe after 30 minutes you change to the other breast, after another 30 minutes change to the other. You are just given only the water part of the breast. But when you empty one breast, you go to that hind one that has protein and fats. You see, you have the tendency of the baby coming out with cheek as per their the fatty lobus is in that one, and those ones now help that breast not to develop lumps, because there are some accumulation of residual breast milk that can even cause what we call infection, mastitis. And that infection can lead to anything from the treatment. If it's not well treated, can be cancerous. So now, I'll go to the third one, hormonal drugs with family planning. Somebody said having boil. Boil is not growth. Boil is boil. So if it is boil, it is not a growth. A growth will not burst. A growth will not bring out pus. Growth is just mass, it's just flesh. It doesn't have anything, any fluid inside. So if it is boiled, there is no problem. It will go. You are just, maybe you need a blood cleanser or something to purify your system. Probably your blood is not clean enough. That's why you are developing boil. It's just a sort of infection. But growth is growth, and we should not link it up with boil. So for the hormonal drugs, actually, I said we usually check when one come for hormonal, for family planning, and if there is any lump, we don't give any hormonal, whether implanol, whether tablets. Then the person go for IUD, intrauterine device, or you go for the barrier method, which is the condom and hostels. So if there is anything that has been suspected and the person go ahead, you take the risk. You take the risk of maybe from the lump, developing into cancer or whatsoever. So if they have detected lump, I'm sure the midwife will not give you the family planning method. And I will from there talk about, okay, the same person was asking of the effect of implanol, that fit ache or whatsoever. It is not the implanol that is causing fit ache. It's an hormonal that works directly with the blood. What it can usually give you, maybe headache or something, sometimes weakness, or sometimes you bleed too much, sometimes you not even see your menses at all. So those ones are normal symptoms that it will resolve on its own, and they usually have treatment for it. If you are not seeing your menses, when you come, we give you what will make you to see your menses. Maybe you have not complained, but some people are comfortable with not seeing menses. Not seeing your menses is not a disease. It's not that you can develop. Some people will say that retained blood will cause cancer. Oh, no. What causes menstruation is ovulation. If you did not ovulate, you cannot menstruate. If somebody did not ovulate, if the ovary did not release egg, the egg are not burst. The burst of the egg is what release blood. That's the menstruation. So if there is no ovulation, what the implanol does is to stop ovulation. So if there is no ovulation, there is no way the person will menstruate, because there is no egg to burst that will bring out blood. That's just the literal way I can explain that. So it doesn't cause anything in our system. If you are not menstruating, it's not a problem. If you are not seeing menses and you're on family planning, it's not a problem. It cannot cause cancer. It's just that if there is a lump before you start that cancer drug, that family planning drugs, it can help it develop. That's what we are saying. But if you don't have any lump, you don't have any growth in your system, and you are on family planning drugs, it cannot make you develop any cancer. Do we understand? So for BP drugs and diabetic drugs, okay, I think the question was if they cause damage to our system. Everything that we take can cause damage. Too much of water can cause damage. Anything that is too much can cause damage. So that is why you go for treatment and you are regulated. So that you are on family planning, that you are on BP drugs or diabetic drugs, does not mean you should not visit your doctor. You should visit them often. Let them review the drugs. There are some times that we outgrow the drugs. There are some drugs that are taken as a normal person, that when you get pregnant, you cannot take it even though you are hypertensive. It will abort the baby. So you should go for a checkup. And once you get pregnant, they change the drugs. After you are delivering, you are supposed to go back to the one that will help you. It's not all the hypertensive drugs that one can take in pregnancy. It's not all the hypertensive drugs that you can take as a nursing mothers. So checkup is very important. That you have started a drug does not mean that you take it for life. Go back to your doctor. Let them check you. Let them review you. There are some blood tests you are supposed to do, liver function tests, electrolyte, urea, and creatinine tests that you at least do once a year, to be sure that your system, your kidney, your liver is working well with those drugs you are taking. Because everything you take, even water, have to pass through the liver. If the liver did not metabolize it, it will not take the cells of the body will not absorb it, so it will not work for you. You see that sometimes you'll be taking some drugs. It has been working before, but it stopped working at a time. It needs review. It means either that dose is not enough for you again, or they need to change to another type. Probably the hormones, the cells have developed some resistance. There's what we call resistance malaria. We know now there are some things that the body system can cause resistance. You just develop, say, I know the year again, I know one meant for me again. Oh yeah. And you have to go and review, and they will now change whether to Daolin. Some people have been on Daolin for years, metformin for years, and he said, no, I don't want that one again. Graduates. So that's where we start to pray for divine healing. But please, let's take caution, and God will help us. So the next question, fruits and chemicals. How we are to handle the challenge of chemicals. Okay, yes, somebody was asking, talking about fruits sincerely in this part of the country, even in Nigeria generally. If you are not in the bush, if you are not in the village, you cannot take healthy fruits. You cannot take healthy fruit. Even all our tomatoes we are taking. Remember from where they are traveling from the north. How many they have passed through the bush and thick and thin and breeze and so even water. Some would have poured inside one this thing, they will go and pack it for you. Some have poured inside petrol and everything, they will go and pack it for you again now. Cover it, shield it. As per tell you that and bring it to Lagos. All the jig and jack, everything dirty is in Lagos. So there is no way you can have anything healthy seriously. And that's why I usually encourage that we get our fruit ourselves. Those of us that like all this smoothie that they would have mixed, please get it yourself. Get your apple, get your pineapple, go and mix it yourself. Do your smoothie yourself. What you do is wash them with vinegar or your salt, enough salt. Wash them, your apple, your your oranges. Wash them yourself at home before taking your carrots. Wash them yourself. I usually use an iron sponge and scrape it. Yes, those carrots, I use iron sponge and scrape, even if it's neatly looking, with salt and water, so that at least even psychologically you are taking something close to healthy, even though might not be healthy. But God will help us in Nigeria. There is nothing we can do. God will help us, but the little we can do, let's just do. And pray that what we are taking, are good for us. But if we can have them planted around us, like some of us have orange trees, guava trees, pineapple. Yes, my mother planted watermelon and all stuff. We can plant it, and so that we can have it. It will be good for us, so that we know that they are fresh. Then the next question was talking about brain tumor. What causes it? Yes. Just as what I've been talking about, the environment is toxic. Our environment, this air we breathe, if they bring a microscope and check it for you, you will not want to breathe again. Some of us will just carry, even with your face mask self, you will still be breathing dirty. Even the face masks gone that they are selling for you. You know how many jargons, how many microbes are on it. If you use microscope and check it, you will not want to use face mask. Not to talk of come and use it and come. So the hair is filled with orishirishi, and so now with the advent of social media, technology, and everything around, all these things they emit chemicals. All these social medias, this one we are carrying for hand, they emit chemicals. They are emitting orishirishi and all of us now we say we are enjoying AC. Yes, by God's grace. By God's grace. Lots of things are happening, even all these our engines and everything. They emit chemicals. So that's why the ACs have outlets. So they are taking those things and exiting them. That's for the ones that the outlet are working, but some their outlet are not working. So as they are emitting them, we are taking them in. So that's why they need servicing often. All these gadgets, it's not that they will just put it and they will not. So what I'm saying is that Brain tumor is common because the atmosphere where we find ourselves is toxic. There is chemical in the air, there is atomic substances in the air, there are lots of things that are acidic to our brain. And together with this technology, our children are exposed to phones early. Phones early. You see a child that is a woman that is breastfeeding will be doing TikTok. So as that baby is sucking, is looking at the mother. That's why you see child at early age, they know what is phone. They will be doing like this. They will be doing like this because what? They've seen you do it severally since they are carrying them, and you are concentrating on them more than on the phone more than them. So they too, they want to be interested in that thing that is carrying your attention. And so I usually tell my nursing mothers, please concentrate on mothers. You have to be looking at me, concentrate on your babies. Look at them and be sure that their nose is not blocked while you are breastfeeding, instead of TikToking and so that's just by the way. But seriously, technology affects children more. We placing what's it called, phone at their head. We say we open Psalm, Abi. When they burn them, they open Psalm in the Bible and open it and put it at their head. Do we know that all those phones, they emit electrodes? They emit chemicals, especially at night. We are not expected to move them close, even to our breast parts. Any part of our body, the skin cancer is everywhere. Any part of our body, they can affect, and especially at night, because the night is meant for rest. So as these phones are hot throughout the day, and the night time, the weather is cooling, that's when they are emitting their heat, and that's when it spreads more at that night when we think we are enjoying, we are sleeping, we are cooling, and we now put the phone close to yourself. We see lots of phone burst and phone blast and lots of things. So let's not move anything close to our system, close to our body parts. They say it's handset, so let it be in the hand, not pocket, not breast. Some of us even put it inside here, have you? We remove our bra like this and shook the breast inside, the phone inside the breast. Yes, people that are selling the market, they do it. We are not expected to move it close to any parts of our system. So please, let's watch out. Those are what can cause all those brain tumors and all stuffs. And for the fact that we eat junks, the food we eat now are not healthy. And so we can always have unhealthy behaviors among our children, especially. So let's be watchful. Now, someone was asking if there is supplements that we can be taking. I've said it. I don't really like anything big, and that's why I said your antioxidants. You can get it yourself. Your vegetables, your fruits, your vitamin C, all those tetenkobaone, they are supplements. They are antioxidant. Those vitamin C that they say, whether it is the white one, whether it's the colored one, is still 100 milligram. Vitamin B, vitamin E. For people that are looking for the fruit of the womb, folic acid and vitamin E is very important that they take it. Very important. It helps and boosts their immune system. So supplements can be on an individual basis. I don't encourage big things, but I encourage homemade things and natural things. Like I said, for those of us that are used to all these our food, I know moi moi, some people still peel the moi moi. You are not supposed to peel. It's the fiber. You are not supposed to peel your moi moi. You are supposed to eat with the back. Your corn and your millet on your wheat, you are supposed to grind it and grind this smooth and eat with the fiber. That back part is the fiber. And there is lots that fiber does, especially to our rectum. it prevents rectal cancer. It prevents cancer of the rectum. That's why you see people will go to toilet and they will force themselves. That is what those fiber is meant to do, to make you poo easily. But because you have removed it, don't you imagine the goats and the sheep that you are giving all those things? Don't you see how big they are? That is the fiber. The fiber contains more of the calories that is in that corn. You are just eating what part of it? Just the carbohydrate part. It's the fiber that has the protein with it. Some of us think that beans is protein. It's not protein, it's carbohydrates. And it is that fiber that has the protein that you now peel off. So we are expected to eat it good. Because of the chemical, you boil it. First, if it's the normal cooking type, you boil it, pour the first water away before you now continue the cooking. That's when it has boiled. Maybe within 5 minutes, pour the water away, then continue the cook. That's for you want to cook beans porridge. But if it's more, soak it and throw the water, soak it and make it soft. Just be sure that you pick it. You are expected to blend with the cover. That is the fiber in it. Moi is supposed to be made like that. But because we are sieving it, that's why we have lots of cancer. Let me say, especially of the stomach and the intestine in our system. So that is just for the supplement thing. So if fainting symptoms like hotness or dizziness or whatsoever, somebody was asking if it means that the person is having cancer. No. Sometimes we have not taken, maybe like now we are in fasting period, you might, if you have not taken food or you have not taken water, you might feel dizzy at a time. Does not mean that you are having cancer or you are having diabetes. So please, the symptom for diagnosis of diabetes, it is a 3 consecutive symptoms, something that occur within, 3 times. Like if before they will say somebody is hypertensive, the person have come to clinic, they check now, if the BP is high, they give you sleeping drugs for you to sleep. They will not give you blood pressure drugs until you come again. It's still high. 3 consecutive clinic appointments. That's what, before they will now say, okay, you are hypertensive. They will not just say from one time, one check and say you are hypertensive. But it's good we check often. Some of us don't check. They brought one old man into our clinic that is slumped in his office. The children, they are well-educated people, that the father, they said he doesn't like checking. Is he hypertensive? They don't know. He has never checked. At 66. How now? At least once, even in a month. You don't like it. Once in a quarter, every 3 months. Check your BP and be sure that you are fine. Even if it's normal, you cannot say today it can be fine. Tomorrow, the problems of Nigeria is too much. All of us carry it up on our head. Hand it over to God, so that God will help you to carry it. Too much school fees and everything. That's what is causing too much problem for us. Let's hand it over to God. So you cannot say your BP might be fine today. Tomorrow it might be high. So you have to check often and be mindful. Know yourself. When you are not feeling fine, you know it. Within yourself, you know that something is wrong. Something is wrong. Like something happened just on Sunday. A woman was preparing to travel out. Her 3 children are outside the country. She just gathered her bag. On the 6th, she was supposed to travel February 6th.